Greetings. In our office, we see two types of conditions, an acute condition and a chronic condition. An acute condition, example like a broken tooth or an abscessed tooth or a sudden onset of an abdominal pain, etc. Those situations are quickly dealt with. If we cannot deal with them, we send them to a hospital, etc. What we specialize in our practice is the chronic conditions. To deal with chronic conditions, I found out for many years that we need a multidisciplinary approach. In order to deal with chronic conditions, I had to gather around me many practitioners who understand the different components of a chronic situation. In chronic situation, we need to deal with a structural component sometimes, a functional component, a biochemical component, an electromagnetic component, or an emotional component. In my long career, I found out in most of chronic situations, we have to deal with more than one of those components. In order to deal with more than one component, the practitioners have to interact, meet, diagnose together this patient's condition. The key point here is to know how to prioritize. Prioritization is very important in chronic situation for many reasons, especially to make the patient understand their condition and not to aggravate their situation, and also to make the patient participate and understand what we are doing and what we are doing for them, and for them to understand the results and how to deal with the reactions. Sometimes in a treatment situation, you could have an acute reaction as we treat, or a reverse reaction. That means instead of patients feeling better in a chronic situation, they might feel worse. Every time a patient comes to their office visit, they fill a symptom update form. As we have several symptom update forms, we are understanding the chronicity of the situation, what component we have to emphasize for this patient to understand and deal with. In chronic situations, for example, a patient with chronic facial pain, when they fill their forms, as you look down their form, you realize the same patient did not complain about he also has neck pain, shoulder pain, low back pain, or maybe leg pain too. In chronic situation, let me give you an example. A patient arrives with chronic facial pain after a motor vehicle accident or a sports injury. But if you look at their history, they have probably lost a tooth 15 years prior, and then they had an orthodontic condition that needed to be treated, but it was not treated. But the patient was able to put up with the situation. Then also, during that period, he was experiencing a stressful situation, like writing an exam, buying a new house, or a relationship problem. And during that time, he was involved in a motor vehicle accident. And that's what I call the straw that broke the camel's back. Now, to understand what is creating this chronicity, we have to find the perpetuating factors. The perpetuating factors, as I mentioned earlier, could be structural, functional, biochemical, electromagnetic, or emotional, or the combination of one, two, or three of the above. That's why I gathered around me many practitioners who understand basic medicine, biochemistry, naturopathic medicine, traditional Chinese medicine, and hands-on physical medicine. Our team, with the dental practitioners, we would like to provide for you a situation that will treat your chronic conditions. This is my 35th year of practice. And over the years, I understood that to treat a chronic situation, you have to have a multidisciplinary approach, and that's why I gathered around me many talented practitioners in dentistry, medicine, biochemistry, naturopathic medicine, and traditional Chinese medicine, also hands-on physical medicine experts. With a combination of our team, we hope to provide our chronic patients relief and for them to understand the perpetuating factors so they do not go back to that chronic situation. And that leads us to the maintenance phase, which is the last condition, maintenance.